Hi, this is Kathy with Dr. Michael Workman. If you've watched our previous videos, you'll know that we've already done a facial assessment on Dr. Workman and that we have previously, about 6 months ago, treated him with Voluma. Voluma is a facial volumizer. It actually creates lift in the face, and we'll be posting some photos of that before and after. He was very sunken in the mid-face here, and we had a really nice result. But as many people are, Dr. Workman is asymmetrical, and he's lost a little more volume on one side. So today he's going to get a little touch-up from his previous injections. And we've kind of looked at him head on, but I can see over here he's much more hollow. So with that, we will get started.
What areas of the face do you tend to use it in?
Primarily mid-face volume, in the cheeks. In the U.S., that is where it is FDA approved. However, in other countries, they use Voluma almost anywhere except the tear troughs and the lips. It is the highest G' of all of the hyaluronic acid fillers, which G' is kind of how it stands up to gravity. So that's why it's ideal for enhancing the cheek area, because it stays put. You wouldn't want to use a product this firm, for example, in the lips, because we want them soft and supple. In the tear trough, it would over-volumize and probably show. So, but for this area of the face, it is perfect.
Can you show them where the tear trough is?
Yep. The tear trough is this circle right under the eye. And some people are really, really hollow here. I do have clients who come in who want tear trough treatment who are really not great candidates for that. And that person is a person who has a pseudo herniation of their fat pad or a big bag. And, you know, you can treat, sometimes you can treat that, but it's really difficult to do because you're trying to camouflage an excess of volume with more volume. And I have really good luck and high satisfaction with the tear troughs that I do, but that's primarily because I don't inject people that I know it's not going to be a good outcome.
How about the folds here that, you know, a lot of people
Yes.
are concerned with those?
Yep.
Why not just really blow that up and put a lot into there?
That's an excellent question, and I will tell you, a huge number of clients come in and they want this area treated. We call that your nasolabial folds. They call them the parentheses of the face. And the problem with targeting this area is, I think we've all watched the movie stars and said, oh my gosh, look how puffy their face is. It doesn't even look natural. Everyone has a bit of a nasolabial fold. Even small children have a nasolabial fold. You're supposed to have one. And when you flatten this totally out, you kind of get that Planet of the Apes muzzle type look. It's less natural. So this is a symptom. The true problem is loss of volume. Because if the face, if the fat pads and the structures underneath were where they were supposed to be, this skin wouldn't be folding over on itself. So my preference is to treat this area first, then we can do a little cleanup in the nasolabial fold if we need to. But when we start, and same with marionette lines, the downturned corners or the oral commissures, a lot of people just want that treated. Well, when we start doing this, we create heaviness in the lower part of the face. And if you think about a youthful face, I'll just set that down for a minute, a youthful face is more heart-shaped. So we have cheek volume and it comes down into a nice, beautiful shape. When we start squaring it off and trying to camouflage jowling, nasolabial folds, marionettes, we can create a real heavy, kind of Dudley Do-Right jawline that is really, it's not necessarily youthful, and it's certainly not, especially on women, super attractive because it kind of hardens the face.
Yeah.
So
one of the interesting things that I've seen is, back in the 90s, we'd go to the big aesthetic meetings and everyone was talking at that point about really tightening up the skin, and oftentimes we would get an artificial look or an over-operated look. Well, in reality, when we age, as she mentioned, we tend to lose volume. That's why old people are very gaunt, because they've lost the subcutaneous fat. And I think what we've found over the last 5 to 10 years is that we're much better off to restore the volume rather than tightening up the skin, which can actually make you look older.
Right. If you kind of want a little harbinger of things to come, when we age, everything kind of falls forward. So put yourself in front of your mirror and look down, and all of that tissue falls forward, and you'll see an enhancement of your nasolabial folds. All of this tissue will come forward. So where we want to create the volume is laterally on the face, so that we're bringing that all back up, and it gives a much more natural appearance.
So how about those people who are taking selfies? Do you recommend they go back like this?
You know, I'm a little older than the average selfie person, but my young friends in their 20s have assured me that the appropriate angle for a selfie
Really?
is above.
Kind of exactly what you're talking about.
Exactly,
Yeah.
and that's because you're looking back and all of those structures, you're giving
Going
yourself
back.
an instant photo facelift.
Interesting.
So that's how the 20-somethings look so cute. And the fact that they are 20. All right. So there's some landmarks that we look for here. There's a little notch in your zygoma or your cheekbone. Sometimes it's palpable, sometimes it's not. There it is. So we cleanse. And we gave him a good cleansing a while ago, too. And then we retract the tissue just a little bit. And we have a needle poke. Ouch, you did great. And as I mentioned before, then we aspirate. And this is a safety issue to make sure we're not in a vessel, because we don't want to be adding filler to a vessel. And we gently inject. The nice thing about Voluma, and basically almost all of the dermal fillers, have lidocaine in them, which is an anesthetic. So once we get started, there's some numbness that comes along with that. And we just do a series of injections along the zygoma or the cheekbone to add volume and lift. And then we do a little bit of pressure. There are, I have talked with clients who said, oh my gosh, I did my cheeks and I was black and blue for 2 weeks. And one of the things that's incredibly helpful is holding pressure after injecting. For fillers, I like to do a little bit longer appointment. I know that I could see more clients if I made my appointment shorter, but this is something I enjoy kind of taking my time with. A, for the artistry, and B, just to help prevent that bruising. And for most of these injections, yep, you're doing great, you're doing great. We go right along that cheekbone. Then we can do a little bit of fanning. And you'll notice as we inject, we kind of pull the tissue back, and it's like we tack it into place. Tear trough is looking a little bit better already. And in the real world, turn toward me. In the doctor's chair is not necessarily the most conducive injection site for me, but also with most of the Voluma clients, sometimes I'll like to lay you down and do an assessment of what happens to the tissues as you fall down, because some people are volume deficient in the front of the cheek. And you can't really tell that until you lay somebody down, because again, everything falls forward. If we overfill the anterior portion of the cheek, you get that kind of chipmunk or the big golf ball front of the face cheeks, and especially when you smile, that's not an incredibly natural look. I just had my cheeks done about a week ago, and I have a very asymmetrical face, which is not uncommon. So we did, I think 1.2 mLs on one side and only 8.8 on the other, just to bring me back into balance. So it's very common for people to...
You said 8.8?
No, I stammered. It was 0.8. So we
Okay.
we did a little over one syringe on one side and slightly less than one syringe on the other.
Do you frequently end up putting, different
Yes.
differing amounts, and
Yep.
that's based upon their anatomy?
Yep. Yep. And I do, when I first learned injectables, I was kind of taught, here's something you can do until you get experience that will work on basically everybody. 10 units of Botox across the forehead, 25 in the glabella. 5 to 15 in the crow's feet. And, you know, in the last 6 years, I've kind of learned a little bit more about how those facial muscles work. And really, I think my assessment skills have honed quite a bit. And I really customize every treatment to the individual because, you know, if we all had the exact same musculature, we would all look exactly the same.